Good morning, everyone. Happy Friday, June 10th. It's great to see everybody here today with us for Brunch Buddies. A couple of housekeeping notes. Please do keep yourself on mute unless you're actively speaking. If you can, put your camera on. We'd love to see you. If you have any comments or questions as we are presenting, if you could put it in the chat, that would be the best way to send the questions over if someone else is actively speaking. If you have any questions that you don't want everybody to see, that's okay too. If you would be able to, direct those over to Carolina Montoya. Carolina is my co-host here today. You may recognize her from other programs here at Seniors in Service. Thank you, Carolina. So if you could, any private questions, feel free to direct directly to Carolina. Otherwise, we will be monitoring the chat. I want to get right into introducing our speaker today. He is no stranger to Brunch Buddies. It's Dr. Gaurav Malhotra, Dr. G, as everyone likes to call him. So Dr. G and his wife, Dr. Poonam Malhotra, founded Absolute Healthcare over 20 years ago with a mission to bring holistic preventative care to the Hernando County area. Since then, he has provided life-changing primary care to thousands of seniors and has become well known and beloved in the community. He has received numerous awards and he repeatedly ranks high in the state of Florida for preventative care, according to the Medicare Star Ratings. He has a second location that opened up in Port Richey, and he has another one opening in Hillsborough, you guys, really soon. I'll let him tell you a little more about that. But Absolute Healthcare doctors and staff are going to be able to bring that same excellent care to adults and seniors in the Hillsborough County as well. Dr. G, thank you so much for joining us today. I'm going to hand it on over.
My God, I feel so big. Well, good morning, everybody. I hope all of you have stepped out to enjoy what Florida has to offer us today. It's such an amazing time of the year. Kids are out of school. The roads are not as busy. We can go out and enjoy the company of the youth in the parks. We can go by the beaches where the weather is perfect, take a little dip in the water. It's just our amazing time. Winter be it summer, I think we are all in paradise. And, unfortunately, the ravages of health and age and some part of neglect do affect all of us. We all neglect or are sometimes in a position that we cannot pay enough attention to things that are important. And all I'm going to do is not going to teach you so much new stuff, but I'm going to redirect your attention to your own lives. Because we're all knowledgeable, we all like to read, we are here today because we are interested. And those who are interested are going to know a lot. So today's topic is blood pressure. And blood pressure, of course, as we know, is high or low. Some people suffer with low blood pressure. Those are also not good things. And they can feel dizzy, but our target today is going to be high blood pressure, which is the common thing that affects the clientele that I deal with, which is typically seniors. High blood pressure can also affect younger people. And we know that whenever we find that, we want to look for a cause that is curable, because in them, there is a much higher chance of us finding something that is curable, that is causing the blood pressure, like a kidney issue, like a blood vessel issue, like something in the brain, something with their hormones. So all these kinds of things are very important to us when we see a person with high blood pressure. Of course, we know that people who have high blood pressure running in their families, they are more prone to having high blood pressure. And as we approach the age of 50, our pressure starts to climb up for one reason or another. And we want to see how we can avoid that. The topic of treatment of high blood pressure, I will keep separate simply because it is so extensive, but I will teach you how to find the real blood pressure in you and what your goals should be. And what are the tools available to you? How can you, and what all to watch out for, how to change your lifestyle. As far as the treatment of blood pressure is concerned with medications, I'm going to leave that to your own doctor, or if you choose to see one of us, then we would discuss that in depth with you. because it's a long topic. Or another thing we could do is have another session and have the treatment of high blood pressure put on over there so that you guys can understand. But firstly, let's see what is high blood pressure and what our goals should be. So I'm going to start to share my screen, which has a PowerPoint presentation. So is that okay with everybody? Okay, there we go. I'm going to start a little slideshow at the beginning. Yes. Aria, has it taken the screen now? Okay, so we're in a good spot with the presentation. Technology is playing ball. So blood pressure and its abnormalities. As I mentioned before, that we have high blood pressure, low blood pressure, but let's understand what is blood pressure. Blood pressure is that we have a pump and we have our pipes, the tubes, through which the pump pushes the fluid, which is our blood, and that creates a pressure. So there always is some amount of resistance in the pipes, as we know that, hey, if we just shut the faucet and we fill the pipe with water, it will still drain somewhere in some with one aspect or another. Mostly in something that is not as alive as our own body, it'll take the gradient of gravity, that will go down. So we don't have enough blood pressure, our blood will go down into our legs, our brain will be deprived of it and we'll fall down so that our brain can again get the blood and then we will wake up again. So that the pressure over there is, the blood is delivered over there and we wake up. So these are just normal things about pressure. So what is our pump? Our pump is our heart. Now, that is the pump that sends the blood out into our body, but our whole body then pumps that blood back to our heart so that it can pump it back again. And that pump is our muscles, is the tone in our blood vessels. Part of it is gravity when we lay down. So all these things are factors that affect the return of the blood so that our blood pressure can stay stable and blood can circulate throughout our body. So why do we need blood pressure? So that the pressure gradient from the heart, which should generate the highest blood pressure, all the way down to my toes, which should have the lowest blood pressure, so that things can actually flow down to my toes or other peripheral parts of my body. And that gradient is what keeps things going. So we need this blood pressure. So the arteries are maintained in a high tone by our nervous system and the muscles that are there in the arteries. So believe it or not, our arteries are made up not just of a little lining, they actually have active muscle tissue around it that constricts, contracts. So that let's say when we are in a very tense situation, our nerves will tell it to contract, our blood pressure will climb up, because the same amount of blood, or maybe even more amount of blood, because the heart is now pumping faster and harder, is going through those arteries that have become tighter, and the pressure is higher so that we can perform high demand functions for survival, for performance, for competition, for sports, or whatever it takes for us to that we are involved in. So the heart's pump and the arteries and the tissues resist and things continue. The pressure can be normal, too high, too low. We also have the difference between the highest pressure that is generated inside our arteries and the lowest pressure that is generated inside our arteries. Now, I want you to imagine a hammer that comes and thumps something gently, and another hammer that comes and thumps something harder. So wider that pulse pressure becomes, more the chances of us harming that tissue that is sitting calmly to receive it, and suddenly a high pressure comes up. We don't want that either. Then we have the pulse rate. It can be either too high or too low. If it is too low, then we may not have enough blood reach on time to the places that we want to. And if it is too high, the heart may not be able to fill up as nicely as we want it to ideally function, so that we are running a half empty pump too much and the pump itself can suffer. And we don't want all these. So we want things in between some numbers. We want our heart rate between 60 and maybe 90. Ideally, we guys try and keep it between 50 actually, which is even lower, because we know that slower hearts last longer. So we put on medicine so that we can keep your heart rate slower. while we keep your pressure low, we keep your pulse pressure low. And then there's another thing called dipping. We know that as we relax at night, which we should, our body should relax at night. We know that at night our pressure actually drops because that tension of the day, the tension of the muscles, the need for activity is no longer there. So we lay down and our sleep calms us down, hopefully in dreams and, and some people in nightmares, I know, that we can actually have a peaceful time and our pressure drops. And we want to see that because in those people in whom we do not see this, we know that their risk of heart attack, heart failures actually jumps up by 100%. So we want to avoid that risk. So we also like to check your blood pressure at night. And there are nice tools that we can offer our patients or patients can buy themselves that can monitor their blood pressures around the clock. So let's go on. Not having a good pressure, of course, will affect our organs. It doesn't affect our bones so much because they're so hard, but the softest tissues take a beating. So what are our softest tissues? Our softest tissues are in our eyes. So we can start to see changes of high blood pressure, long-standing high blood pressure right within the eyes when we look inside them. An eye doctor can tell you that, hey, there is some silvering of your arteries over there because they have hardened. There might be calcium built up. There might be just too much of scarring built up onto the arteries, which we call sclerosis. So we do not want to see these. We want to keep your bodies nice and supple so that when blood comes through them, it can actually flow properly. We know that sudden death can happen because the heart takes a beating. The arteries of the heart take a beating. We know that the softest organs also belong in our kidneys. Our kidneys take a beating. We get most of the people who go on to dialysis have either blood pressure or diabetes or a combination of both beating them down in what we call the metabolic syndrome. So they have the obesity that's coming with it, the high cholesterol coming with it, the high blood pressure, diabetes, and sleep apnea. All these things give the body a beating. So we want to decrease that morbidity. And as we may have mentioned in the past, that we were the most effective weight loss program in our county out of a contest of multiple teams. Dozens of teams had joined into the contest, and ours was the most effective because we know that high weight will demand high pressures from the heart to circulate the blood throughout the body, which has so much tissue that higher pressures are demanded. And then the entire cycle of the body deteriorating, the heart deteriorating, the closest tissues to the heart that are taking that high blood pressure beating, those deteriorating, that all starts off into a cascade that is difficult to stop until we reverse the actual bottom line cause. The pulse rate also, as I mentioned to you, we know that blood pressure can be just because of no good reason, which means we can't find a reason. We call it primary hypertension. We also call it essential hypertension. Many times when you go to your doctor's office and you get the discharge, the note that you take home, the summary of your visit, that might have the diagnosis, essential hypertension. Essential for us means that, hey, we don't really know why, but the body is creating this in order to continue to function. We used to believe that this is necessary as we age. Now we know that that is not true. That in seniors, we actually need to be even more mindful of the high blood pressures and bring them down even lower. Our goals used to be different in the past. Our goals used to be 140/90 in the past. No longer. We know that if we can lower the blood pressure further down to 120 or 80 or below, we can give you way better survival. We can give you way better survival of organs, less damage to your organs. Your heart will last longer. Your kidneys will last longer. Your brains will last longer. Because with high blood pressure, what happens is that there are small little holes forming in your brain tissue as well. We don't want that. We want every little bit of your brain to survive so that as old age approaches, the sharpness, which as it is destined to fall, is not falling down quickly because of these holes that the high blood pressure has poked inside your brain. So we want all these things. So that essential term still exists, but we call it primary or idiopathic, where we don't know the reason. And we know that there are some forms of lifestyle and some hereditary factors that impact blood pressure. So it's important to know that. that if my father or my mother has blood pressure, I will have a higher chance. If there is extra resistance in our body, we'll have high blood pressure. Let's say, so these kidneys are our kidneys have a very nice method of regulating our blood pressure because they want enough circulation to come into them so that they can filter all the toxins and continue to have the blood flow back and the urine flow out with all the toxins that our body produces. So if the kidneys pressure, the pressure inside the kidneys drops, they are going to tell our heart with a certain hormone, hey, upregulate the blood pressure, please, raise it. So let's say if there is a narrowing in the arteries to the kidneys, then we know that the kidneys will feel as if not enough blood is coming, although the heart is doing its job very well. And in many cases, we just go in, we open the kidney artery, and things are flowing much better, and the blood pressure automatically drops. This we see a lot when people have blood pressure in the younger age. We know that there is something called fibromuscular dysplasia, which affects the arteries that causes this. And it's a simple fix for us. So we go in, we open it up, we put a stent, and bye-bye. Now you have your usual usual pressure until old age comes and then brings you high blood pressure. There are some hormones, so supplemental hormones like birth control can raise blood pressure. So it's important to know that. Medications can raise blood pressure. Our diet, if we have a high salt diet, we have a high fat diet, high sugar diet, all these. And we know that it has a good impact to have a healthy diet. Of all our lifestyle modifications, actually, the DASH diet, which is to decrease unhealthy foods, typically brings our pressure down. It has good fresh vegetables, less non-vegetarian food, less salty, less sugary, less fatty type of diet, and that decreases our blood pressure. We also have alcohol. People don't realize that they might be stuck with alcohol. I don't know if I ever mentioned to you my own life story where my father-in-law was visiting. He was staying with me, stayed a month, and every evening I would share a beer with him. Month came on, he was visiting, he left, and I found myself reaching into the refrigerator, something I never did before. Immediately, that recognition came to me, which I was fortunate. I took out all the beer from the refrigerator, put it out in the pantry. That's all I needed to do. Because you feel that, hey, I want to keep it chilled. If a guest comes, it'll be there. But who is the first consumer? Yourself. And if you really want to avoid that vice, don't make the vice readily available to you. Say, hey, I'm going to put it away in a spot where it's not going to impact me. So alcohol raises our blood pressure by 4 or 5 points. And that means it is a lot. It is the difference between an inflated balloon and slightly more inflated balloon. You know how easily that one will pop? So every little bit that we can improve in our pressure by improving our lifestyle or altering our lifestyle is beautiful. We know that emotions impact our blood pressure, the worst being anger. You know how some people will die in a fit of anger. So we don't want that. We want to keep that. We want to make sure that our emotions do not reach a level where we guys feel that we are going to kill somebody at that time. Because our pressure rises up so much, it's like bang, and that one little bubble popping in the head or somewhere else in our body in a critical part will harm our body terribly. So we want to keep our emotions nice and calm and peaceful. We know that in the morning when we are waking up, our blood pressure rises. Our blood pressure is usually highest early hours of the morning because the machinery is being started up. We've had that nice calm blood pressure all night, and then suddenly our pressure starts to climb up, maybe 4 o'clock in the morning, starts to go up and up and up until we wake up and stays up for a little bit, and then comes down a little bit until nighttime comes, and then it drops further when we sleep. So these are things that I want you to know about blood pressure, that what it does, how it does, what are the risk factors, what can we do to change things in our blood pressure. There are many other causes like medications that can cause high blood pressure. So visit your doctor with all your medicines. If you cannot make an accurate list, I love those patients who bring their box and say, here, doctor, is what I'm taking. And then I go through their medicine box And I still there find that there are medicines there and they're not actually taking, but they're still sitting in that box. So I tell people that keep a pill box. It makes it so much easier. If you have more than 2 medications that you have to take every day, it's much easier to keep a pill box and organize it for the month or so that your management is more accurate and easier. So we have a bunch of medicines over here that I've listed that cause high blood pressure. I've taken this all from Up to Date, which is a paid subscription that we physicians typically have access to, that we read. All of you also have access to it if you pay, but you don't need to, because for us, we are researching hundreds of topics at a time, and for you, you might have one or two things, so the utility is not as much. Amongst my patients, I share the articles from Up to Date and say, here, you can also read what is available to me. And they allow that. That once in a while, I can share things with patients who would like to be more educated. Because as I may have mentioned before, the meaning of the word doctor is not a healer, but is a teacher. So I'd like to teach you how you can help your health, that how you can be in charge with somebody like me, a good physician by your side, and say, let's walk this and make it easier for everybody. Once you know it, because blood pressure, you come to my office for 15, 20, 30 minutes, we check your blood pressure, but what you are really facing is the pressure that is standing in your body throughout the day. So we advise our patients that please check your blood pressure at home before we start making changes just on the basis of 1 or 2 or 3 blood pressures in the office in a 15 to 30-minute period. We don't want that. We want to see what your average blood pressure is. And if your average blood pressure during the entire day is less than 130, we are not going to bother you with more medicine. But if you come to my office and say, hey, doctor, check my blood pressure, and we check it, it's 145, I'm going to be inclined towards, I'm going to be tempted to start a medicine for you that you don't even need. And I will increase your cost, increase the chances of side effects, the interaction, and the agony of taking more medicine, whereas you don't even need more medicine. So your numbers are very important to us. So bring me your box of pills, bring me your log of blood pressure. If you do not have a blood pressure machine at home or would like to buy one, we sell one in our office for about $20, which we measure against the expensive machines that we have in the office, and we check how they're doing for you. So also bring your blood pressure machine. If you have a machine at home and your pressure remains high, bring your pressure machine. We will compare it to ours. We will see that your machine is working accurately or not, or does it need recalibration? So these are small little cues that you should follow in order to get your blood pressure treated when you visit your doctor. There are many causes other than that, like I talked about sleep apnea, which is OSA here, the 4th on the list. There are some hormonal issues that can cause high blood pressure. In our practice, over the last 20 years, the 5th one, called pheochromocytoma, we have found about 5 patients with this rare disease that causes high blood pressure. Once we took care of this little tumor that was there in them, pressure was gone. Blood pressure was cured. So it's very important to keep our eyes open as we talk to you, to be able to let you express yourself when you have something to say, because in your speech, in my questions and your answers lies some beautiful secrets that we can actually help each other out. You'll make my job easier. Now, some people have high blood pressure because the main artery of the body is narrowed beyond the part where the branches for the upper arms where we measure our blood pressure goes. So our lower body blood pressure might be way lower than the upper body blood pressure, whereas in a normal person, it should typically be the opposite. So if we can hear something unusual in your chest or on your back, then we can start screening for that as well. There are sometimes that we can see some abnormalities of that disease or disorder, on a chest X-ray, and we do our X-rays in our office. So immediately we have access to doing these things. So I think as a physician, I think I am no smarter than you. I just have to buy more tools to remain more effective than you yourself. And because, a general contractor, for instance, builds you a house. You could build yourself a house if you had the right tools and a manual to do it. It'll take you more time. But you will have to buy so many tools that won't be useful to you thereafter. So that is why we hire somebody who has all the tools and do this. So this is why you come to a physician. More the tools, better off you are. We have a scanner for your heart in the office. We can see if your heart is suffering, that if your heart is becoming sick. We can do an EKG on your heart, which can tell us that yes, your heart is becoming sick from that perspective as well. But we have to clue in and then just look for those things to say, is there more tension on your heart that it has to become thicker in order to meet the demands of your body? And if so, then we look for why. Then what is happening? What are we missing? Once we know that we have found a problem and we are missing the reason, a good doctor will always go look for the reason. So we have multiple stages of blood pressure. As I mentioned, that when you're in the doctor's office, we're typically looking for pressures below 120/80. But we know that, hey, on average, during the day, as you keep checking your blood pressure during the week, maybe you check it once, you bring that to us and we see it's below 130/80, we're not too bothered. But 120/80 is typically the target these days, and that's where we want to go. So people start to think that, should I take 10 different medicines? Should I take high doses of one medicine? The best method is to take the lowest possible doses of multiple medications. Little squirts of these little things will create less poisonous effect in your body than big doses of one thing. And we all know that. Everything in moderation, the same thing goes for our pills as well. Because as we go higher on our doses above certain levels, we're going to have more side effects than the beneficial effects of the medicine. So we'd like to say, so when your doctor says that, hey, let me start another medicine, don't be surprised. Don't be shocked and say, hey, why do I need one more medicine? No, he, instead of increasing your current blood pressure medicine, is just going to add a squirt of a different one in addition, so that he can gain more benefit for you without putting more side effects on. So we don't check blood pressure. We don't create or diagnose hypertension without taking multiple readings. For those who already have a diagnosis of hypertension, we know that, hey, somebody must have done the due diligence, create and started you on some treatment. All we need to do is adjust a few things, or maybe not even that. Maybe validate that the benefit is adequate by just giving you a proper blood pressure monitor, teaching you how to check it correctly, what position the body should be in, etc. So there's something called white coat hypertension, which we always are concerned about, that when you come to the doctor, the tense time is there in your life. That little moment is a little more tense, as if you're sitting for an examination through, like a high school exam or something, and your pressure, your tension level climbs up, and you're worried about him giving you the reports on your labs, your pressure will climb up. Once you have everything good, you go home in your normal state of life, usual state of health, is when the blood pressure should truly be monitored. So white coat hypertension, I no longer wear the white coat, by the way, in my office. It is possibly the dirtiest piece of garment that a physician brings on towards you, because it doesn't get washed every day. Most physicians don't wash the white coat every day. They'll put it on a hanger, they'll leave it in their office in the back, and they'll go home. They'll come back, and the same thing is now being exposed to 20 other people. So I wear scrubs. They're easy to use. They're non-fashionable. I don't impose on you as if I'm superior than you, or, I'm just one of you. I'll come there. I would probably sit on the countertop or somewhere, just like another guy who came to meet you, and we'll have a little drink together. There are times when I just share a little drink with my patients in the office. People who maybe want to lose weight, etc. I'll give them a sample of something and say, hey, let's have this. It's a drink I like. It'll help you lose weight. Let's try it out. People say, no, I hate diet soda. Say, hey, man, we need to get you off of this regular soda. So let's bring you this. There are times when I'll take both cups of diet soda and they'll say, hey, this one is diet and this one's not. And I'll tell them, no, both are diet. So, sometimes it's our head, sometimes, and different things play with our head. Suggestion plays with our head. My behaving as if I'm better than you in one way or another or in every way, is a terrible feeling to have from your physician. You want to feel that you can hold your physician's hand and talk to him or her and just pour your heart out. So we want that to happen. We want things to calm down. We want your problems to be our problems, and you go live your life. Say, hey, bud, you don't need to worry about this. This is my headache. You are bringing yourself to me, whether it's anxiety that bothers you, whether it's knee pain that bothers you, whether it's back pain that bothers you. Let me help you. Let me guide you. And then you will be calm. You go home, you check your pressure. Pressure remains good. You don't need any additional medicine. Masked hypertension is something that when you come to the doctor's office, pressure is okay, but when you go out, it's high. So which number do we believe? There are some people who love to see their doctor. When they go there, they're so nice and calm. When they go home, they have to see their spouse. So their pressures might be going up. And so we want to make sure that we're not missing something, because we want to treat you in your usual state of life, usual state of health, usual life that you're going to be living in. If the pressure there is going to remain high, we want a squirt of treatment out there. So tiny little doses of good medicine to go in there so that you don't suffer too many side effects. So people think that should my doctor be pumping that thing up and then listening with that, or should they be checking with the machine? So it has been found that both are equally good. The machines are just as good as a good technician checking your blood pressure. Now, the good technician may or may not be there. Sometimes I have seen that the technician will not write the right number simply so that they don't aggravate the patient, etc. So much better to blame the machine. Blame the person on the outside, not me, not you. Hey, the machine is telling me this. So when somebody is doing drugs, it's not you, not me, but the test is telling me this. So similarly, it takes the subjective bias out of the measurement and just takes a number that is displayed to you objectively. And today's machines, the modern machines, are just as good as a good technician. So, and good machines are available for $40, $50 in the stores. So our goals we've talked about, then there is something called ambulatory blood pressure monitoring. Arya, tell me if it's coming to time, okay? Because I don't want to overshoot. All right. So there is the different types of ways that we can check your blood pressure. Ambulatory blood pressure monitoring. We can give you a piece of equipment you take home, you keep wearing it for 2 or 3 days or 1 day and bring it back to us. And we see all the readings that is taken throughout the day. But you checking your blood pressure at home is almost equally as good. These machines cost $2,000 to $5,000. It costs a visit to the doctor. It costs a revisit to the doctor. It costs the analysis of that thing. The software cost is about $4,000 to $5,000. You start looking at it, we are unnecessarily increasing the cost of healthcare without any advantage. When you checking your blood pressure with that inexpensive machine that is going to last you a long, long time and help us treat you even in the future is just as good as my equipment that I want to give you and make some money out of, why should I increase the cost of the entire system? So most good physicians will just tell you, hey, check your pressure at home. Don't have to make it that you have to check it so frequently, because it should not be something that's going to make you tense. But when you remember, hey, put your arm in that machine, turn it on, put it in a place where it's prominent, and write it down so that you come to me, you bring me the whole thing. There is nighttime monitoring. Nighttime monitoring because we want to see your pressure drop down. We want to see your body calm down, that the adrenaline level in your body should go down, the tension in your body should go down, and pressure should drop. If that is not happening, I'd mentioned before in this lecture that, hey, there was a twofold increase in heart disease in people whose pressures were not going down. So we want to prevent that from happening. So we want to see the dipping is what it's called. It's not the other dipping that we call with tobacco chew dipping, okay? So it's the dipping of our blood pressures at night. And there are definitely some tools that are available to you. We can give you a little watch that you can wear that would interfere with your sleep time as well. And it'll check your blood pressure at night and give us the reading so that we know that these things are happening in you as well. Then there is a risk calculator for 10-year risk calculator. If you look online, you'll be able to find it. It's a 10-year cardiovascular risk calculator. It asks you these factors that what is your risk? And if your risk is above 10%, then we have to take special measures to bring your blood pressure goals are a little different compared to those of those who do not have the 10% or greater blood pressure risk. We also like aspirin to be started in those people. We also like to make sure that they're on cholesterol medicine. We want to see them back more frequently so that because they have a higher risk of something going wrong with their hearts or having a stroke or dying because of one of these causes. So we want to prevent that from happening by seeing you a little more frequent and making sure that all your risk factors are well taken care of, including your cholesterol. Then there are multiple labs that we like to check when we check you for blood pressure. It's not just say blood pressure check and you're gone. No, we want to see if your kidneys are being damaged. So we want to check that part of your body. We want to see your urine, that is it losing blood in it? Is it losing protein in it? Because the most critical proteins of our body will otherwise be lost in our kidneys. And as we see the kidney damage is occurring, we want to be more aggressive and more diligent with your blood pressure treatment so that you don't end up on dialysis. We want to check your cholesterol, the EKG. We want to take a urine sample, check the protein as I mentioned, and an echocardiogram to see the thickness of your heart wall. People with thicker heart walls are going to demand more food supply from their body to feed that thicker heart muscle, which means that even a small narrowing in their coronary arteries, which are the arteries that supply the heart, can cause a heart attack. And every heart attack has a risk of death. So we want we want your heart muscle to be nimble. We want it to be slim, just the right size, so that it demands just enough food so that it can keep you alive and does not suffer deprivation because it wanted too much. So we, of course, have the treatment, we have lifestyle, we have medications. There was a new device that also came up that could be implanted in the kidney artery that changed blood pressure significantly. 1 year, it became highly fashionable to use this. And a couple of years later, we found out that it doesn't have many advantages. So I'm just bringing it up here because you will see it being mentioned and you will think, hey, my doctor never mentioned it. Your doctor did not mention it simply because it is no longer a recommendation. So how can you make a difference to your blood pressure? This is a nice screenshot. It tells you what you can give up, what you can keep. It gives you the benefit. So in this screen over here, you see where it says, not column 1, not column 2, not column 3, where it says those, but column 4, where it says hypertension. Yeah. So it tells you hypertension. If you have hypertension, the other one is normotensive if you do not have hypertension. So this is the impact that this part of lifestyle will have on your blood pressure if you change things. We know that with weight loss, 1 kilogram weight loss, which is 2.2 pounds, let's say 2 pounds, every 2 pounds that you lose, your blood pressure will drop by 1 point. So there comes that effectiveness of weight loss that we perform. That if we can get your weight down, your pressure will drop by significant quantities. And we want that benefit because it has so many other advantages. Then we have the healthy diet. It tells you what exactly it is. So please take a screenshot of this if you can on your phones, on your devices, so that you can go back on this and revise this. And Arya also is recording this meeting. So I don't know if you share it with all your members, but if you do, then they will have access to this once again to go over. Then we have reduced sodium intake. For the longest, we have known that salt increases blood pressure by 5 to 6 points. So you can decide how advantageous that is to you, whether you want to give up salt or take up tennis or take up another physical activity. You know, I'd much rather enjoy my salt and keep my nice physical activity going with. And I may have mentioned to you before, I choose those activities in physical exercise, which also have a social component to them, because that social component itself brings so much positivity. So I no longer go bicycling, but I like to go play tennis. I'd like to play ping pong. You know, I'd like to go and have pool volleyball or something like that with friends. So those types of activities, or go hiking with a friend, those types of activities make much more impact on my life in multiple ways. And that's what I'd like you to embrace, because they're fun. And what is fun no longer remains a chore or an exercise that you have to do. It becomes something that you want to do. And that is where we want your life to be. So there is dynamic resistance exercise, there is isometric resistance exercise, and there is alcohol consumption. So can I give up alcohol? Of course I can. Would I like to? Yes. Why would I like to? Simply because alcohol not only impacts my blood pressure, but also impacts my brain. Now, our fat in our body is soluble in alcohol. The fat in our brain keeps our nerves insulated, and as alcohol reaches it, it may dissolve some of them. As it dissolves some of them, our insulation in our wires is gone, and the transmission of our impulses, of our messages, becomes slower. So we will have loss of brain. And our best real estate, now that Florida is having this real estate boom, you must preserve your own body's best real estate right here. This is what makes us who we are. Preserve this for the longest, and you can truly enjoy a beautiful life. So avoid alcohol for multiple reasons. Medications, as I mentioned, is a huge discussion. We'll keep that for another time, or you discuss that with your private physicians, or if you join us, then we will have a discussion on which medicines are better for what age, what race, what gender, all these things that can have an impact, what other comorbidities you have that we want to target for if somebody has diabetes and blood pressure, which medicines do we like to give? Somebody has swelling in the ankles and blood pressure, what medicines do we want to avoid? So those kinds of things. So I'm going to end the talk with our marketing message.
Yes, and if Allison wants to put any of that information in the chat, please feel free to do that. Also, any information that you'd like us to send out to our volunteers, send it on over, and we can send it out in a recap email. I have a feeling that everybody is already looking forward to the next time that you're going to come visit with us for our brunch. And I do want to make sure, if you would like to talk about your upcoming office opening.
I suspect in 2 weeks, the Tampa office will open on Bush Boulevard.
You hear that, you guys?
Yes. We have a very nice, it's a rather private type location, but even though it's bang on Bush, it is gated. It has a fence in the front. It has a huge big sign out there which says 411 pain, which is not us, because we're not a pain. And it is between Busch Gardens and 275 on Bush Boulevard, and it is bang on 20th Street.
Perfect. And if you don't mind, we have a couple of questions. We will have to go through them pretty quickly. These are the questions from the chat. You guys, in order to be able to do bingo, I'm not going to be able to take any questions from anyone directly right now, but I will go through the ones that are in the chat. So quick Q&A. Which is better to use, the arm or wrist blood pressure machine?
Both are good.
Both are good. Okay. Does it matter
whichever one
which
fits
arm?
you best? It should fit you best. So the inflatable part of the cuff should cover about 80% of that arterial spot.
Okay, perfect.
So if your arms are really big, you don't want to go up there. And all of them are calibrated to give the number that we want to give right out of here.
All right. And does it matter which arm you're using?
It does not matter which arm you're using. I advise people to alternate arms, because sometimes we find a huge difference between the two arms, in which case we have to look for a second problem.
Got it. Got it. Okay. And I know that you had your insurance information on there. Can you go back a couple slides? And that'll answer two of the questions, I believe. Let's see. I do see that we have someone asking how to share this presentation. We will send out a copy of this presentation in an email, the same way that you got the invitation to this Brunch Buddies. And you're always welcome to forward that email on to your friends and family. So thank you so much for asking that, Miss Hunter. Allison, yes, thank you for answering that in the chat. So you accept Medicare, HMOs, and Medicare Advantage plans at all locations. All
Yes.
right, so we will have to invite you back because I know everyone just enjoys your presentation. I do feel like I need a Dr. G to like guide me through my day. So if you have an office opening in Pinellas, let me know. I will be your first new patient. All right.
That is
60
so
days from
lovely.
now,
Thank
okay?
you. Thank you so much. And thank you so much for having me here, allowing me to teach you all.
Thank you. I know that we all appreciate
you.
it. Yes.
I really did.
Thank you. All right, Dr. G, if you want to hang out for some bingo, I'm going to be sending out that
No.
virtual link right now. Today we have a heart health bingo inspired by our presentation. So thank you so much, Dr. G, for bringing that to some things to remember,
Oh,
some things to
lovely.
incorporate into our day. So I just sent that out. The virtual bingo link is in the chat right now. And if you don't want to hang out with us and you need to get to your dance party, because I remember you saying Fridays are the dance parties, definitely understand that too. But we just appreciate you so much. So thank you, Dr. G and Allison,
Such a
for being
pleasure.
here with us today.
Thank you so much. I'm going to check out and stop share.
All right. All right.
Okay.
Thank you. Everyone say bye to
Gracias.
Dr. G.
Thank you for
Bye,
everything.
thank you.
Gracias para todo. Adios. Bye-bye.
Adios. Thank you. And the information is in the chat there as well for Dr. G's offices. But in the chat is also the bingo link. So if you want to participate in bingo, click on that link. It's going to bring you to your bingo card. It will open to a new screen. So don't worry if you're in a new screen. We are doing 5 in a row. Make sure to claim that free space in the middle. So 5 in a row, any which way.
Should I keep my volume open? So when I show you'll know?
As long as there's no background noise, I won't be opposed to it, all right?
So if it is background noise, then I say bingo or I have
When you get a bingo, go ahead and holler out bingo. We will have a little moment to pause in between each one. And if for some reason you can't get the card open, that's okay too. We'll have a few more opportunities to win at the very end. So I'm going to go ahead and get started. The first one is lifestyle. Lifestyle.
Okay.
Next is melatonin. Melatonin. As Dr. G was saying, that healthy sleep helps to contribute to our heart health. So first one was lifestyle. Second is melatonin. Third is exercise. Exercise. Next is tension. Tension. Next is sodium. Sodium. So we've had lifestyle, melatonin, exercise, tension, and sodium. Next is blood sugar. Blood sugar. And as a reminder, if you get bingo, nobody close your cards until we confirm bingo. All right, so blood sugar. Next is stroke. Stroke. Next is water.
Bingo. This is Carmen.
Carmen. All right, we have Carmen with a bingo at water. Does anybody else have a bingo at number 8 of water?
And I had it before water. I just couldn't. I had
That's
it at stroke.
okay. You had it at stroke. Okay, no problem. So anybody have a bingo before call 7 stroke? Carmen, can you go ahead and let me know what your card ID is?
029.
029. All right, and that was at call 7 for stroke. All right, and I do see that Carmen has a bingo straight up and down. So Carolina, if you can go ahead and put down Miss Carmen Lake as the winner for our bingo. Thank you so much. You guys can go ahead and close out the cards. Congratulations, Carmen.
Thank you.
Now, next up, before we do our opportunity drawings, I wanted to give Carolina a minute to talk a little bit about what she does here at Seniors in Service.
Hi, everyone. Good morning. Sorry, I couldn't find the mute button.
It's okay.
But thank you so much for having me today for Brunch Buddies. It was a great presentation from Dr. G. A lot of good insight on how to manage your blood pressure at home and when you go see your doctors. So go ahead and take that information. We'll send the recap and just share with anybody that you know might help. But what I do here at Seniors in Service, I am part of our newest initiative with our resource advocates. We've partnered with another nonprofit here in the Tampa Bay area called the Resource Empowerment Center. Many of you are well aware of it. Miss Katrina Osborne is the director over at the REC. That is the nickname for it, which is the REC. So if you are ever looking for services or need help with accessing any type of community resources, so that could be help with your housing. So if you need help finding rent resources, we all know that the Tampa Bay rent is skyrocketing in the last couple of months. So that's something that we've been dealing with a lot lately. Food security, if you need help renewing your food stamps or applying for food stamps, that's also something we help with. Transportation, if it's getting you set up with your own transportation with your health insurance, or maybe bus passes, all of that we could help with. And we have dedicated volunteers just like yourselves that will help you along this process so you don't feel alone. Because it can be daunting at sometimes trying to get these applications in and trying to figure out your portals and your logins. So having that extra set of hands and help goes a long way. So that's what they do. But if you ever have questions about what resources or how we can get you connected, I will put my contact information in the chat. You all are talked to many of you already on the phone about different resources. So that will be in the chat. Okay? So give me a call and I will answer you and we'll get you started.
Thank you so much, Carolina. And in a couple of weeks, we will have Carolina back speaking all about the services that the REC has to offer, as well as some other important information that is useful for people that are living in our area. So that was just a little taste of what Carolina will have in store for us coming up in a couple of weeks. All right, so next up we have our opportunity drawings. We're going to pick 3 winners. So give me a second. I'm going to share the wheel of names.
Hello.
Sure. All right, there we go.
Hello.
Yes, we can hear you.
Okay, this is Cassandra. Just 1 second. Can I get Carolina's phone number?
Carolina, if you would be able to share that in the chat. Yes, you'll have that.
I got eye drops and my eyes is not focusing. So if she could just give me a number, I appreciate it. Can you do that?
We'll do it after the opportunity drawing. We'll give Miss Aria.
Okay, I appreciate that. I appreciate that.
All right, you guys. So let's go ahead and can everyone see this? The wheel? All right, we'll get started. All right, the first winner is Carmen Lake. Carmen Lake is our first winner. The next person is Cassandra Fuller. Cassandra, you are our second.
Oh, well, praise the Lord.
And the last but not least. Oh, that's a close one. Cynthia Allen. Cynthia Allen is our third and final winner for our opportunity drawings. You guys will be receiving a card in the mail with a little token of our appreciation for being our dedicated volunteers. We are so happy to have you guys here. Before we leave today, I do want to make sure to make an announcement. You guys may have seen an email that has request for you to fill out a survey. So your input is really important to us. Seniors in Service has been selected by the Pinellas Community Foundation to participate in a learning experience that focuses on diversity, inclusion, and equality. This training helps us develop strategies to ensure that we're reaching all communities in the best way possible. The first step in this learning process is to understand where we are at now and how we need to improve. So this is where we need your help. When you get a chance, please take 15 minutes to complete the survey. It was emailed out to you. If you can finish it by June 22nd, so in the next couple weeks. It's an anonymous survey. We will not see your individual responses, and your input is very valuable, and it's going to help to strengthen our approach of services to all the communities. So again, if you see that email, you may actually have your coordinators reaching out to you to fill it out. If you could please fill that out as soon as possible, so then we can take that information into consideration and make sure that we're serving our community in the best way possible. I know that Carolina is going to connect with Miss Fuller here in just a moment, but before then, I just wanted to thank everybody again. Thank you so much for being here. We look forward to our brunch buddies, our time together, and you know, Dr. G always has some great information for us, so we're really thankful to him and looking forward to coming back in a few more weeks. Thanks, Carolina, for being an amazing co-host as always. And most importantly, thanks you guys. Thank you for making our community as dynamic as it is. And thank you for all of your work in our community. It is the best community possible because of you. And that is each and every one of you. So if you have anything else, feel free to hang out. Carolina and Ms. Fuller, you guys can go ahead and communicate. Thanks everyone for joining us today.
Thank you so much.
Enjoy your
Bye.
afternoon.